Welcome everyone to our presentation on nurses at the front line of public health, emergency, and preparedness and response. Lessons learned from HIV/AIDS, COVID-19, Zika virus, and Ebola. So the introduction to this article focused on first, that WHO designated the Year of the Nurse in 2020 to 2021. And it highlights the role of the nurse is central to mitigating, so slowing down pandemics like COVID-19 and HIV/AIDS. And the objective of the article was to understand how nurses contribute to the scale, reach, and effectiveness of emergency responses and how we can learn from those for future pandemics. So we're first going to start off by looking at the contribution of nurses in HIV/AIDS pandemic. And we're going to look at the scale, the reach, and the effectiveness. So first of all, the scale. During the HIV/AIDS epidemic, one of the first things that was identified was the importance of task shifting from physicians to nurses for testing and for getting antiretroviral therapy out to people. It increased HIV testing and ART initiation, especially in resource-limited settings. So really broadened the scale of who they could reach. The second was, as I just said, reach. Community-based testing models were initiated in rural areas, and a couple of key examples were in Nigeria and Tanzania, and this improved access to care in remote areas. And three was the effectiveness. So a stigma-free approach was found to be really important for HIV. And so there were innovative nurse care models, such as the one in San Francisco, that provided a stigma-free approach. And this enhanced ART adherence, so antiretroviral therapy adherence, and retention in care. And for those who may not know, ART is what's given to patients once they become HIV positive to slow down the progression of HIV. So the lessons that we learned from the HIV/AIDS response is we learned that decentralization, and so getting care to decentralized areas, so away from central hospitals, was important, and nurse-managed care models improved care delivery. Collaborative efforts with lay health workers enhanced efficiency. This is where we get into using community health workers in communities. And addressing the stigma was key to improving patient outcomes. So nurses in the COVID-19 response. Well, the scale is we were able to expand our inpatient and intensive care capacity as nurses provided 80% of the care in ICUs. And the challenges we know were the acute shortages of personnel and equipment and the elevated risks and mortality among nurses. Nurses in the Zika virus response. So first of all, what is the Zika virus? Well, it originated in Uganda in 1947, and it's transmitted by a mosquito, so a vector, and it affected pregnant women. So the Zika virus during pregnancy can cause infants to be born with microcephaly, a congenital abnormality. So you can see here the small head, equally small brain. And in 2016, WHO declared Zika-related microcephaly a public health emergency, especially in areas of Brazil, Dominica, Montserrat, and Puerto Rico. And so nurses were part of the Zika virus response. So REACH, they were the backbone of services in remote and underserved areas. They provided education and care for high-risk groups like pregnant women. And the lessons learned was there should not be a delay in disseminating evidence-based information. So it's important to get that information out as soon as possible. And also the role of a Zika response nurse coordinator was very valuable. And then nurses in the Ebola virus outbreak. So what is Ebola virus? It originated in 1976 in the Dominican Republic of Congo, so DRC, and now found primarily in sub-Saharan Africa. It spreads through human-to-human transmission and is highly contagious. It's a deadly disease. People begin to bleed both internally and externally, and it kills between 25 and 90% of those infected, about 50% on average. The largest Ebola outbreak to date was an epidemic in West Africa from December 2013 to January 2016, with significant amount of cases and deaths. So nurses in the Ebola virus response, effectiveness, they provided treatment and palliative care despite the high risks. They worked to rebuild trust in health systems. And the lessons learned was the highlighted the importance of both psychological and technical preparation. So the key lessons that we've learned across all these pandemics are: one, the importance of an expanded workforce, address the shortages and enhance training. Number two, task shifting, enable nurses to manage broader responsibilities. Three, community-based models, enhance access through nurse-led delivery. Four, leadership roles, include nurses in public health planning and in those leadership roles. And the importance of emergency preparedness, so the importance of integrating this into nursing curricula. And so recommendations for future preparedness are infrastructure development, timely dissemination of evidence-based practices, technology using user-friendly tools for nurses in peripheral facilities, research, nurse-led studies to enhance health system resilience because nurses have been at the forefront of these pandemics, and public communication, leveraging nurses as trusted messengers. So the calls to action are: recognize and amplify the role of nurses in public health emergencies, advocate for public changes to expand nurses' scope of practice, and invest in nursing education and leadership training. Thanks for listening.